Okay, we're ready to start, Commissioner, whenever you're ready.
Good morning, everyone, and welcome to the Connecticut Insurance Department's public informational meeting on 2021 health insurance rate filings for Aetna, Anthem, ConnectiCare, Harvard Pilgrim, and United Healthcare Oxford. I'm Andrew Mays, and I am the Insurance Commissioner for the great state of Connecticut. Now, this is an informational hearing. We will get presentations, we will get testimony, and if at the end of the presentations and testimony the public has any questions, you can use the online meeting chat feature if you're using your PC, or you can send an email to cid.ratefilings@ct.gov. That's cid.ratefilings, RATEFILINGS @ct.gov. To go through some of the details here, Aetna has requested an increase of 18.9% in the small group market. Aetna does not participate in the individual market in Connecticut. Anthem has requested an average increase of 9.9% in the individual market and an average increase of 9.5% in the small group market. Anthem participates both on and off Excess Health, which is our Connecticut Health Insurance Exchange. ConnectiCare has requested an average increase of 5.5% in the individual market and an average decrease of 0.2% in the small group market. CBI only participates on the exchange. Now, ConnectiCare Insurance Company has requested an average increase of 4.0% in the individual market and an average increase of 10.3% in the small group market. Now, this ConnectiCare company only participates off the exchange. ConnectiCare Inc., which is an HMO, has requested an average increase of 5.2% in the individual market and an average increase of 10.0% in the small group market. Harvard Pilgrim, for its HMO, has requested an average increase of 12.7%, and for its insurance company, an average increase of 8.4%. This is both for the small group market off exchange. Harvard does not participate on the Connecticut exchange. United Healthcare's Oxford has requested an average increase of 10.3%, while Oxford, a wholly owned subsidiary of UHC, has requested an average increase of 14.5% for its HMO and an average increase of 13.4% for its insurance company. All three companies only participate in the small group market off the exchange in Connecticut. Now, just as a reminder, the small group market is defined in Connecticut as employers with 50 or fewer employees. If you have not yet seen them, copies of the filings and related correspondence have been posted on the Insurance Department's website for public review and for comment since July 24th. These health plans in total currently cover approximately 214,600 Connecticut residents. Now, the Insurance Department is currently conducting actuarial reviews on each of these filings to determine if they are justified, and will make the ultimate decision to either approve, reject, or modify the request later this month. Given the way health insurance and premium increases touch the lives of consumers of these rate requests, I am very interested in hearing from those in the community about these filings. And I wish to provide an additional opportunity to the public to become informed about the specific rate proposals. And this is what today's informational meeting is all about. We've got some top-notch members of the Connecticut Insurance Department staff assisting in this effort here with me today. There's Paul Lombardo, who is Director of the Life and Health Division, Trisha Dave, who is an insurance actuary, Jared Koski, the department's general counsel, and Marge Breen, Managed Care Program Manager. We will begin with presentations from the insurers separately on their respective rate requests. The presentations are to be up to 5 minutes each, with Anthem and ConnectiCare getting an additional 5 minutes to explain their filings for both individual and small group on the exchange market. The department will then ask questions of each company, and after the conclusion of the presentations and the department's questions, we will open it up to the public in the order in which they have signed up to speak. Please, if you're speaking, address your comments to the given subject and be as concise as possible in your 3 minutes. If you have already submitted written comments to the insurance department, then I ask you to summarize the written comments rather than restating them in full. When speaking, please identify yourself. Your remarks should be specific and should relate to the pending health rate filings that are before the insurance department. In order to make sure that everyone has the opportunity to comment today, please limit your comments or questions, as I said, to 3 minutes or less. And any question, just to repeat, has to be directly related to one of the rate filings discussed during this informational hearing, and the department will respond accordingly. When you speak, please make sure you speak clearly and address your comments directly to me. So housekeeping, I would also like to ask everyone to silence your cell phone or other electronic devices for the duration of this meeting, and please mute your microphone if you are not speaking. So with that, I will now turn it over to the Insurance Department's Life and Health Insurance Division Director, Paul Lombardo. Paul?
Thank you, Commissioner. At this point, we will turn it over to the carriers for their presentations, beginning with Aetna and then going in the order of Anthem, ConnectiCare, Harvard Pilgrim, and then United Healthcare Oxford. As Commissioner stated, each carrier will have 5 minutes, with an additional 5 minutes given to ConnectiCare and Anthem because they are in both the individual and small group market. So I ask now that Aetna begins their presentation. Thank you.
Good morning. My name is Mary Beth Liang, Plan Actuary for Aetna's New England market. I would first like to apologize that I'm not on camera as I am having technical difficulties getting through our internet security restrictions in time for this morning's meeting. But thank you for this opportunity to present information on our small group rate filing. Aetna is working hard to make healthcare simpler, easier, and more convenient for the people of Connecticut. Aetna files rates in the small group market only, with approximately 125 individuals covered under our small group policies as of July 2020. Our average requested rate increase is 18.9% for our one silver plan offering. I would like to start off by noting that the changes discussed here are average rate changes. The exact rate change will depend on factors including when the member's group contract renews, the age and family size for enrolling employees, and employer contributions. To develop these rates, we take the historical claims experience and project it forward to 2021. Because our calendar year 2019 experience is not fully credible, we've included 2 years experience and blended 2018 and 2019 together as our claims experience base. There are 4 main drivers for these rate changes. They include medical costs rising, estimates of the average morbidity in the small group risk pool, changes in taxes and fees, and other items, including claims experience coming in differently than we expected. I will now review the main drivers of these changes in more detail. First, healthcare costs and associated trends are the primary determinant of premiums. Medical and pharmacy costs increase mainly for 2 reasons. Providers raise their prices and members get more medical care. Our projected paid trend for medical only is 11.6%, and pharmacy is 14.7%, for a total trend of 12.5%. The second driver is our estimate of average population health and expected risk adjustment transfers for ACA products have changed to reflect new data on market average premiums and population health. Small groups purchasing insurance have a higher morbidity than we initially anticipated. These changes are expected to increase costs by 9% over the experience period. The third driver is changes in taxes and fees. The health insurance fee has been repealed for 2021, which results in a 2.6% reduction to our first quarter 2021 rates. And lastly, a bucket of other items contribute to a minor decrease, including 2019 claims experience emerging higher than we originally anticipated, being offset with lower G&A expenses. With the increase requested in this rate filing, we expect this will result in an expected medical loss ratio of 90%, which is 10% higher than the 80% minimum prescribed by the federal law for individual and small group health insurance. I am confident that these rates are not excessive, inadequate, nor unfairly discriminatory. Aetna is dedicated to increasing transparency within the healthcare system and helping members best utilize the plans that they have. Members can access Aetna Navigator, a secure member website, which allows them to research their specific plan benefits, healthcare providers in a given area, and in some locations, the cost of certain healthcare services. Additionally, Aetna's DocFind directory helps members locate in-network doctors and hospitals to save money on their care. The Aetna Navigator streamlined mobile app is also available to help members to take their care on the go. Thank you for the opportunity to be transparent in our rate development process.
Thank you, Mary Beth. Now I'd like to give Anthem an opportunity, and we will give Anthem again 10 minutes to present their individual and small group rate filings.
Good morning, Commissioner. My name is Steve Ribeiro. I apologize. I'm having technological difficulties this morning. I was not able to log in. Good morning, members of the Department of Insurance, the Office of Healthcare Advocate, legislators, and members of the public. Thank you for the opportunity to be here today. As I mentioned, my name is Steve Ribeiro, and I'm here on behalf of the applicant, Anthem Health Plans. I serve as Anthem's Regional Vice President of Sales. Joining me is Teresa Reardon, Anthem's Regional Vice President of Provider Solutions, and Tu Nguyen, Anthem's Director of Actuarial Services in Connecticut. We are here today to present our 2021 individual and small group rates. Anthem is seeking a 9.9% average rate increase for our individual plans, which insure approximately 28,000 members, and a 9.5% average rate increase for our small group plans, which insure approximately 25,000 members. This represents a range of -2.1% to 14.2% for individual, and a range of 3.8% to 13.7% for small group. At the outset, I would like to say we understand and appreciate the Insurance Department's charge of reviewing the individual and small group rate applications is always complex. We recognize it is particularly challenging this year due to the impacts of COVID-19. In an environment that continues to be uncertain, the department must ensure that the rates requested meet the statutory criteria that they are adequate, not excessive, or unfairly discriminatory. A stable insurance market is dependent on products that create value for consumers through premium rates built on a known set of conditions that enable the broad spreading of risk. This year, the market is more uncertain than ever, and Anthem's rate application for 2021 reflects those uncertainties. We considered four primary factors in our rate filing for 2021. First, as in previous years, we are forecasting that those individuals with more significant healthcare needs will be the most likely to purchase and retain their coverage. This may be particularly true in today's environment where individuals with chronic conditions often have more severe COVID-related symptoms, making them even more likely to seek the protection of health insurance. This shifting demographic, combined with the guaranteed issue market and rating constraints, will continue to accelerate the trend of increased morbidity facing the market. Second, we factored in benefit modifications, including changes made to comply with the updated actuarial value requirements. Third, our filing reflects changes in taxes and fees and some non-benefit expenses, including the discontinuance of the health insurance tax in 2021, the reinstatement of the PCORI fee in 2021, and assessments designed to cover costs of certain state programs. It's important to note that worthwhile programs like Easy Breathing, needle exchange, and lead prevention education that were previously funded by the state are now funded by assessments on the insurance industry. In total, these and other initiatives account for 1.2% of our individual rate request and 1.5% of our small group rate request. Finally, our 2021 rate filing reflects our best estimate of the overall COVID impact, which includes the cost of testing, COVID-related treatments, demand from deferred services, and any increased morbidity due to those deferred services. In short, planning and pricing for ACA compliant health plans, which has always been complicated, is even more challenging this year due to the continued deterioration of the population morbidity and uncertainty around COVID-19 impacts. As previously noted, Anthem, like all insurers, is required to have rates that are adequate, not excessive, or unfairly discriminatory. We take that obligation seriously. Offering products at adequate rates that are sufficient to cover the underlying benefit expense of the population served is necessary to both meet our commitments to our members and ensure market stability. We are equally committed to doing our part to implement initiatives, programs, and products designed to meet the evolving needs of members and the communities we serve. To that end, we believe it is possible to simultaneously reduce underlying healthcare costs while optimizing the health of our enrollees. These efforts include a variety of clinical initiatives and product design features that help our members achieve their best health and receive the right care at the right time and at the right place when they need it. Our ultimate goal is to engage our members to become active participants and purchasers in connection with their health and health care. For example, in this past April, Anthem began a multi-pronged effort to improve the current processes within our individual segment. Through these efforts, we identified several opportunities to further enhance our clinical programs and member engagement. This included opportunities to reduce out-of-network care when qualified providers exist in-network, as well as opportunities to support members who, particularly during the COVID pandemic, are increasingly looking for safe and effective alternatives to facility-based care. We will implement all identified enhancements to our products by January of 2021. Additionally, we are offering new products for 2021. For example, we enhanced and simplified our tiered benefit offering in 2021 to deliver even greater value to our members. Specifically, our filing includes a gold tiered plan that is priced 11% lower than our on-exchange 2021 silver plan. Under Anthem's gold tiered product, members will have lower premium costs for coverage and also enjoy lower out-of-pocket expenses when they receive care from participating Tier 1 hospitals and providers. Additionally, members will continue to have in-network coverage for all participating hospitals and providers in Anthem's extensive network. Finally, Anthem is introducing a new product to foster and enhance member engagement with primary care providers. Studies have shown that individuals who have a relationship with a trusted primary care provider are more likely to receive evidence-based care, have higher satisfaction with the healthcare system, and are less likely to need care in an emergency room or through a hospital admission. This product will utilize our new Blue Care Prime network. Our filing includes a gold Blue Care Prime product that is 16% lower than our on-exchange 2021 silver plan. As I mentioned, Anthem is committed to meeting the evolving needs of our members and the communities we serve. This has become increasingly important during this unprecedented time of COVID. For example, during 2020, Anthem made the decision to waive member cost share for COVID tests and treatment through the end of the year. Further, since many on-site office visits were converted to telehealth visits, we waived the member cost share associated with telehealth visits. We'll continue to monitor and look for ways to support our members as the situation evolves. Additionally, to help facilitate access to healthcare, we are now offering members of our commercial medical and dental plans the option to use Alexa-enabled devices to take actions such as order prescription refills and look up health plan information. This initiative is part of our commitment to offering members a digital-first healthcare experience that allows them to access their healthcare where, when, and how they want it. Through an Alexa-enabled device like an Amazon Echo or the Alexa app, Anthem Skill is a 24/7 voice-activated way for members to quickly access benefit information. A natural extension of our commitment to our members is our commitment to the greater community where our members live and work. We are dedicated to improving the lives in the communities we serve through efforts to foster deeper relationships and build innovative solutions to combat this global pandemic, address health inequities, and adapt to the ever-changing healthcare environment. On a national level, we provided $2.5 billion of financial assistance to ease the burden of the COVID-19 pandemic. Locally, here in Connecticut, in partnership with our philanthropic arm, the Anthem Foundation, we provided $1.4 million in grants to address the needs emerging from this pandemic, including food security, access to mental health treatment, and virtual health care and programming. We trust the information presented during this hearing will be assistance to the department as it reviews Anthem's rate application. Thank you again for the opportunity to speak with you today.
Thank you, Stephen. We're now going to turn to ConnectiCare, which again will have 10 minutes to present as they are both in the individual and small group market. ConnectiCare, go ahead.
Good morning, and thank you. My name is Neil Kelsey. I'm the Chief Actuary for ConnectiCare. I am a fellow of the Society of Actuaries and a member of the American Academy of Actuaries, and have over 35 years experience in health insurance actuarial work. I'll begin my remarks with a brief overview of ConnectiCare and the markets we serve. Our company was founded in 1981, right here in Connecticut, by a group of physicians looking to offer a different health insurance option for employers and residents of our state. Our mission is to create healthier futures for our customers and the communities that we serve. Our goal is to offer products that meet the health insurance needs of Connecticut and continue to be the partner of choice for employers, brokers, and residents. We offer plans for large and small employers, plans for individuals and their families, and plans for retirees and other individuals who are eligible for Medicare. Today, ConnectiCare covers almost 80% of the individuals purchasing health insurance through Access Health CT. While individual is the smallest segment of the commercial health insurance market, it is also the most visible and one that is critically important for the health of our state. For many individuals and families, the individual market is the only option for accessing comprehensive health insurance coverage. Given its challenges and uncertainties, many carriers, both nationally and here in Connecticut, have abandoned the individual market. In contrast, ConnectiCare has participated in the individual market and has partnered with Access Health CT since its inception. Enrollment in the individual market in Connecticut peaked in 2016 and has fallen 33% since then. The contraction is partially due to the elimination of the individual mandate and non-subsidy eligible individuals choosing to forego purchasing health insurance. These individuals tend to be younger and healthier, which puts additional upward pressure on relative costs. We agree with legislators and others that affordability continues to be an issue in Connecticut and across the country. We are extremely mindful of the impact that rate increases have on our policyholders, especially those that are not eligible for federal subsidies. We strive every day to keep our plans as reasonably priced as possible within the reality of today's healthcare environment. ConnectiCare has always been and will continue to be proactive in managing costs. We're working with our hospitals, doctors, and other medical providers and offering programs to help control costs and improve health outcomes for our members. We're doing this by engaging medical providers throughout the state in 12 accountable care organizations and other value-based payment arrangements, offering limited network plan designs that include our highest performing ACOs, engaging in detailed reviews of drug prescribing on a member and physician level to optimize both cost and efficacy, expanding utilization management programs to reduce practice variability and to ensure compliance with evidence-based medical criteria, investing in disease and care management capabilities that target chronic conditions and members at high risk, with a focus on social determinants of health and the diverse cultural needs of our members, and accelerating the delivery of well-being and disease prevention programs through our subsidiary, WellSpark Health. These activities have made a significant difference in providing access to needed care and managing costs. At the same time, medical costs continue to increase, necessitating increased premiums. Over 80% of the premium dollars which we collect are used to pay for care for those who need it. There are numerous moving parts which influence our needed rate increase. Some increase the needed rate level while others decrease it. Three of the major factors driving the requested rate action are similar to past years: medical cost trend, the federal risk adjustment program, and changes to the health insurer fee. In considering our required rate for 2021, there's a fourth factor, the impact of COVID-19. And let me spend a few moments on each of these items. As in past years, the most significant driver of the required premium increase is medical trend, the increased cost of reimbursing healthcare providers for the services they provide to our members. Medical trend includes a higher cost per medical service and the increased utilization of health services. Medical trend is impacted by both medical and pharmacy services. Unit cost is the amount a provider charges for a health service. ConnectiCare does not provide healthcare to our members. We pay hospitals, doctors, pharmacies, and others to provide that care. We know from our contract discussions that doctors, hospitals, and other providers are seeking to charge more for their services in 2021. Utilization is how members use care. Examples include hospital admissions, a doctor's office visit, or a lab test. Overall utilization of healthcare services continues to increase. Our rates must be sufficient to account for the rising costs associated with the higher cost and utilization of health services. The Affordable Care Act implemented a federal risk adjustment program. When an insurer's business is healthier than the overall market, that insurer pays into the program. When an insurer's business is less healthy than the overall market, they receive funds from the program. Our rates must be adjusted to account for the impact of these payments. The Affordable Care Act also imposed a health insurer fee on insurance companies. This fee has been permanently removed beginning in 2021, which reduces our required rates. As we are all aware, the COVID-19 pandemic has had a significant impact on medical costs in 2020 and is projected to have a substantial impact in 2021. Our experience to date in 2020 has been mixed. Beginning in mid-March and extending through May, we saw a decrease in people using medical services as elective procedures and non-emergency care were suspended. In June, as the pandemic weakened, our members returned to see their doctors for healthcare unrelated to the pandemic. We saw more claims for services in June and July than during the same months in prior years, and the severity of the claims was higher than historical levels, which signals a quick and intense return to pre-COVID-19 patterns. The economic impact of COVID-19 pandemic has been disproportionately felt by individuals and small business owners. As an industry, health insurers took the following actions to remove barriers to care. Working with Access Health CT and the board of the Health Reinsurance Association, we took the lead on establishing a 4-week special open enrollment period. As a result, over 2,200 previously uninsured individuals were able to get coverage. Waiving member cost shares for testing, office visits, and treatment. Covering telehealth visits for any medical and mental health services without member cost share. Increasing prescription drug refills to cover 90-day supplies of many maintenance drugs, and offsetting premium credits in some market segments. In addition, ConnectiCare mobilized its extensive outreach program called Peace of Mind to provide members with additional support during the pandemic. ConnectiCare nurse care managers and our service team proactively called members who may be more vulnerable to the coronavirus and provided critical information to help keep them safe. Our clinical team, including social workers, have a strong community relationships that enhance our ability to connect members with additional resources. We've assisted with a wide variety of needs ranging from prescription drugs to billing questions and telemedicine services to dealing with stress and anxiety caused by the pandemic. As we look to 2021, we have considered the impact that COVID-19 will have on medical costs and utilization. Our modeling considered the following impacts: a second, less costly wave of COVID-19 that will overlap with the flu season, less of a reduction in elective services during the second wave, as individuals are more comfortable continuing to seek care and as providers find more ways to offer care safely. Increased costs with more testing. Costs associated with treatment of COVID-19, including uncertainties around the cost of therapeutics. a general decrease in the health of the population as a result of the deferred treatment of chronic conditions and routine services that began in 2020. A vaccine or multiple vaccines early in 2021, with a slow and steady uptake throughout the rest of the year due to availability and initial vaccine hesitancy. Overall, the higher costs associated with testing, vaccination, treatment, and deterioration in population morbidity will outpace any savings due to a reduction in services during the second wave. As I have discussed, there are many numerous moving parts which influence our needed rate increase, and I've attempted to outline them clearly today. For almost 40 years, we have been Connecticut's local health insurance carrier, providing vital services to the residents of our state. The health of our members is our top priority. We give generously to our communities, supporting over 150 nonprofit organizations throughout the state with $1 million in donations annually. We not only offer financial support, our employees are out in the community volunteering their time to help others. In addition to providing quality health plans, ConnectiCare has been giving back and serving Connecticut residents since 1981. We do this because when we look at our customers, we see ourselves, we see our neighbors, and we see our families. We are committed to creating healthier futures for our customers and communities while maintaining a prudent approach towards our finances. Thank you for the opportunity to present today.
Neil, thank you very much. Next is Harvard Pilgrim. Harvard Pilgrim will have an opportunity to present for 5 minutes. Go ahead, Paul. Thank you.
Thank you, Paul. Commissioner Mays, Mr. Lombardo, and staff of the department. My name is Paul Bartosik. I am the acting market vice president for Harvard Pilgrim Healthcare here in Connecticut. Thank you again for your invitation to present at today's rate hearing. I also want to thank Governor Lamont and you, Commissioner Mays, for your leadership during this unprecedented time and for your collaboration with health insurers to ensure the best possible healthcare access for Connecticut residents, especially those at risk for or diagnosed with COVID-19. As you know, Harvard Pilgrim Healthcare is a not-for-profit health services company that currently serves 1.2 million members throughout New England, offering a wide array of high-quality health plans right here in Connecticut. The COVID-19 pandemic may have changed the world around us, but Harvard Pilgrim has stayed true to our mission of improving the quality and value of healthcare for the people and the communities we serve, including finding innovative ways to meet the needs of employer groups and members during this time. Consistent with our values, over the course of the COVID-19 pandemic, we prioritized supporting our partners at nonprofit organizations, those in the provider community, and of course our members. Toward that end, Harvard Pilgrim Healthcare provided over $40 million in financial advances to providers throughout the region, helping them maintain reliable cash flow during very uncertain times. We issued $1.2 million in grant funding to Connecticut independent primary care providers, assisting their efforts to reopen practices safely, supporting their telehealth practices, and the timely administration of vaccines. We also provided another $1.2 million to 37 Connecticut nonprofit organizations, including community health centers in Bridgeport, East Hartford, and New Haven. We also supported the Bridgeport COVID-19 Relief Meal Delivery Project. In coordination with your leadership, Harvard Pilgrim Healthcare implemented a successful premium deferment program for our business customers. Along with issuing premium credits to our fully insured groups, we continue to offer telemedicine visits at in-person payment parity for providers and free to members. We continue to provide free COVID testing and treatment through our plans as well. What a truly uncertain time we are all living through right now. At Harvard Pilgrim, we are grateful for your collaboration and pleased to provide this support and more to keep Connecticut residents and the healthcare system healthy and strong. Again, thank you for the opportunity to present this information to you today as context for our recent business engagements and leading into 2021. As you review our 2021 small group rate submissions, I want to point out that the rates submitted do not include a COVID-19 related load. Instead, our submitted rates represent a true analysis of our member experience and claim trends. Other considerations include changes in benefit design and product mix, risk transfer payments, and state mandated benefits. Compared to the 2020 small group portfolio, the 2021 small group portfolio rates represent an increase of 8.4% for HPHC Insurance Company and 12.7% for Harvard Pilgrim Healthcare overall. Reflected in those rates are changes in membership mix that make up our small group book of business, changes in estimated risk transfer, cost trends, and the removal of the health insurance tax. We certainly will answer any specific questions you may have related to our 2021 rate development. We sought every opportunity to provide both cost containment and value for our members while providing high quality coverage at a time when healthcare access is vital. Thank you again for your time today. We look forward to learning how we may best assist you moving forward.
Thank you, Paul, for your presentation. Next is United Healthcare. You'll have 5 minutes. Go ahead, Michael. Thank you.
Good morning. I'm Mike Dabrowski, and I'm an actuarial director at United Healthcare. I'm responsible for the 2021 Connecticut small group rate filings submitted by United Healthcare and Oxford Health. We proudly serve over 50,000 small group members in the state of Connecticut and strive to provide the best care possible at the lowest possible cost. Today, I'd like to provide an overview on our proposed 2021 rate changes, discuss the major drivers of these proposals, and address the impact of COVID-19 on our 2020 financial results and our 2021 rate filings. Overall, we are requesting a 13.4% rate increase for Oxford Health Insurance, a 14.5% rate increase for Oxford Health Plans, and a 10.3% rate increase for United Healthcare Insurance. 4.3% of the rate request is to account for an experience adjustment, and the remainder is to account for benefit changes and trend. Rate changes for members vary from a decrease of 3.1% to an increase of 17.4%, depending on the member's benefit selection and renewal period. Benefit changes vary by plan, but overall, we have increased the benefits being offered to our members in 2021. Based on the aggregated claim experience from each carrier's supplemental healthcare exhibits, the market-wide trends were very high in Connecticut in 2019. Based on this analysis, 2019 claims increased by over 14% compared to 2018. These trends are driven by the increased cost of medical services and the increased utilization of these services. Our benefit cost ratio for 2019 was 86%, which is higher than our target BCR and higher than many other carriers' 2019 BCRs. We filed similar experience adjustments for 2019 and 2020 that were reduced. A 4.3% experience adjustment is necessary to account for rising trends and a declining BCR. Finally, I'd like to discuss the impact of COVID-19 on our 2020 financial results and our 2021 rate filings. COVID-19's impact on the healthcare system has been unpredictable and challenging. During the early stages of the pandemic, many states, including Connecticut, issued stay-at-home orders that prevented residents from traveling outside their homes, except for the most basic essential needs. These orders, along with the general fear surrounding the uncertainty of COVID-19, caused many members to reschedule elective procedures and avoid care except under the most necessary circumstances. Because of this, claim costs were reduced significantly in April and May. However, as we've already seen in our June and July claim experience, members are beginning to feel more comfortable about seeking medical care, and as a result, claim costs are returning to normal levels. Although 2021 will also likely be a very challenging and unpredictable year, all indications point to claims returning to normal levels, and there are no indications that claim costs will be reduced back to the unusually low levels that we witnessed in April and May. Additional costs are also expected to account for COVID-related testing, treatment, and vaccines. These services will likely increase our 2021 claim costs above normal levels, but due to the uncertainties regarding costs and timing, we have assumed no impact in our 2021 rate filings to account for COVID-19. In addition, we set up a premium forgiveness program in 2020 to help members who have faced financial struggles during the initial pandemic period. Through this program, we provide refunds to all groups that were enrolled in May of 2020 to help with financial needs, and we will continue to strive to meet our members' needs during these challenging times. Finally, I just want to say thank you for allowing us the opportunity to address these items today.
Thank you, Michael. And thank all the carriers for their presentations. I'd now like to turn it back over to Commissioner Mays as the Insurance Department portion of the meeting begins with questions that the department has for the carriers. Go ahead, Commissioner Mays.
Thank you, Paul, and thank you to all for the presentation. I'm going to ask a few questions here, and I will tell you up front, the heavy lifting is going to be done by my great staff who understand I am not an actuary and I can't go into all that. They know that much better than I do, and they will be asking those technical questions. But I will tell you, I go around the state and there are some questions that keep recurring. And one of the first questions I'm going to ask has to do with COVID and with what has happened to health insurers during this emergency. And I will say the health insurers have stepped up to help their customers. I will also say that there have been side effects based on the fact that COVID-19 has driven down utilization. There were far fewer people in the hospitals over the course of the height of the COVID crisis. I'm looking at the New York Times here. There's an August 5th story, and it says, and I'm reading quotes here, the nation's leading health insurers are experiencing an embarrassment of profits. Some of the largest companies, and they cite Anthem and United Health Group, among others, are reporting second quarter earnings that are double what they were a year ago. CVS Health, which owns Aetna, the big insurer, posted much higher earnings. Now I'm going to turn it over. I'm going to ask whichever one of these companies wants to answer first. But my question to you is the same question it's a question I get most from people as I talk to them about health insurance rate increases. Given these huge profits that have been reported, these record second quarter profits, why should people who are struggling during this COVID epidemic, people who may be out of a job, why should these people be asked to pay more for their health insurance? And I will turn it over to whichever company wishes to take the lead. I know it's not a great question, so I'm going to pick first. I'm going to start with United Health.
Thank you, Mr. Commissioner.
Okay.
Well, as I mentioned earlier, obviously this is a challenging time. It's also a time that is very different than any other time in history for health insurance. We have seen, as I mentioned, claims decrease in mid-March, April, and May. But as we have seen in our June and July claims, members are beginning to feel more comfortable seeking care. We also do expect an increase in costs due to vaccines and treatments related to COVID-19. So there are several indications that 2021 claims will actually be higher than what we've seen, not only in 2020, but in 2019 and 2018 and so forth. Obviously, it is an unpredictable time. It's an era that we haven't had before, and we just believe that claims will return to 2019 levels based on what we've seen in June and July, and then also with the additional costs.
Thank you.
Thank you.
Anthem or Aetna?
This is Neil Kelsey from ConnectiCare. I would just point out that the savings that we saw in, as I noted in my statement, in March through May, a lot of that utilization that disappeared during the early days of the pandemic came back pretty heavy in June and July, and our experience in those 2 months is actually on par or higher than the same period in 2019. So we don't expect the savings to continue throughout the rest of the year. We do think people are engaging in care, and engaging with the medical community to get the care that they need, which will translate into medical costs for us. Throughout this period, we have given premium credits to certain segments. We've given extended grace periods to help customers. We've waived cost share for certain services, following all federal and state guidelines and things that we think make sense for our members and small employers and large employers to help them through this unprecedented time. I'd also point to the federal backstop through the MLR rebate process, which looks at a rolling 3 years of average claim experience. And if less than, in the individual and small group markets, if less than 80 cents on the dollar are used to provide medical costs, and in large group 85 cents on the dollar, carriers have to rebate to customers at a future time. We're projecting, we've rolled our experience forward a couple of years, and we are not projecting any rebates. Said another way, even with the rate increase that we're proposing, we will be spending in excess of 80 cents on every dollar to provide medical care to our customers.
Let me switch to my next question, and this one is maybe a little easier, and this is for Anthem and ConnectiCare. Now, this is a question from a consumer that I'd like to pass on. The consumer would like to know if Anthem and ConnectiCare benefits make their on-exchange individual plans available to individuals off-exchange if they inquire. Why don't we start with Anthem first? Stephen?
Yeah, thank you, Commissioner. Yes, we make our plans available both on and off exchange with some slight variation.
Okay. And ConnectiCare?
Yes, anybody can access the plans that we offer through the exchange on Connecticut Benefits Inc. The one thing that if you access them directly as opposed to going through the exchange, you lose any possibility of getting federal assistance in the form of tax credits or lower cost share.
Okay. I hope this answered the consumer's question. If you have any further questions, I would direct this to all consumers. Please feel free to reach out to the department if you have questions on health insurance or any other kind of insurance, ct.gov/CID, and we've got a great staff sitting there waiting to help you, so please reach out. I've got one more question for Anthem, Stephen. And it has to do with your testimony a few minutes ago. You were talking about the gold tiered plan that's priced 11% lower than the silver plan on the exchange. And you've got another plan, the gold blue care prime product, that is 16% lower than the on exchange silver plan for 2021. I'm just wondering, because if I'm sitting here as a consumer looking at this, I'm thinking the exchange should have the cheapest plans. Are there differences in coverage? Why is this less expensive? Why does this require less of an investment? And if I'm a consumer looking at a plan like this, should I feel that I'm going to get all the coverage that I would get with another plan, for instance? Stephen, I'm going to turn that over to you.
Thank you, Commissioner. Yes, the gold tier plan offers a higher level of benefit with a tiered network, which means if you see a tiered provider, either at a facility or a hospital, you have a lower co-insurance. You still have your Anthem in network for the remainder of your coverages, and you also have Anthem out of network. The Blue Care Prime network is a network based around obtaining services through a primary care physician. It's our belief that a primary care physician is essential to providing the right care at the right time in the right facility. So both of the plans offer comprehensive service. It's a difference in the network, and it would be our recommendation that the individuals looking to purchase either of those programs look at the network and see which one best meets their needs.
Thank you, Stephen. Sorry to put you on the spot with that one, but it really caught my attention. I appreciate your sharing that.
My pleasure, and I appreciate the opportunity to speak.
And with that, I'm going to turn it back over to Paul. We do have some testimony lined up, as well as questions from the department. And as I mentioned earlier, people can keep, if you're a consumer watching this on CTN, you can send in your questions, and it is, as I search for the information on here, it is cid.ratefilings@ct.gov. So if you have questions, feel free to send them in. Paul, over to you.
Thank you, Commissioner. I have a series of questions. Some of them will be for all carriers. Some of them will be directed to a handful of carriers. I'd like to start out with, I think ConnectiCare and United, Neil and Mike have already described, and correct me if I'm wrong, Neil and Mike, that your expectation for 2020 utilization, the mix of services, or at least utilization anyways, is expected to return to 2019 levels throughout the calendar year 2020 as a result of COVID-19. It sounded like there was a period of time where utilization dropped significantly. It's picked back up, but I think both of you mentioned that your expectations is that it would revert back to 2019 levels. I'd like to ask Aetna, Anthem, and Harvard in that order what your expectations are for utilization of services in 2020 as a result of COVID-19 compared to 2019. Aetna and Mary Beth, I'd like to start with you.
Hi, thanks. Yep, we have similar results that we're seeing as United and Anthem. Our claims dropped severely in March and April, offsetting any costs for testing and treatment, but we did see claims begin climbing in May and are closer to historical norms in June. We're seeing prior authorization activity has returned back to historical norms, and consumer confidence related to healthcare services is increasing. So overall, we are expecting 2020 costs to be neutral to pre-COVID forecasts. The supply of tests increase and the availability of free testing decreases, and so we expect testing claims to drive significant costs in the coming months. Deferred claims will continue to return, but the ultimate level of claim activity is uncertain. The ongoing spread of the virus will drive higher treatment and testing costs in certain geographies, but may also trigger care deferral in harder hit areas if there's a second wave. But we have performed internal modeling and scenarios very widely at this time. So due to the uncertainty of how the impacts of COVID-19 will materialize, we did not include any adjustments into our 2021 rates.
Thank you, Mary Beth. Anthem?
Hi, Paul. This is Tu Wing from Anthem.
Hi, Tu.
For Anthem, we see a similar pattern. Do you hear me, Paul?
Yes, Tu, I hear you. Yep.
Hi, Paul.
How are you? Go ahead, Tu. Oh, it sounds like we lost.
Hi, Paul. Do you hear me?
Yes, I do.
Hi, Paul. This is Tu Wing from Anthem. For Anthem, we do see a similar patterns as well. For March, April, and May, we did see a reduction in claims compared to 2019. And then in March, we start to see claims to rebound. So we do anticipate for the second half, the claims will rebound, probably will be 1% to 2% higher than seasonality adjusted compared to 2019 or going back to historically.
Thanks, Tu. And I'd like to give Harvard Pilgrim an opportunity to respond to the question as well.
Yes, thank you, Paul. So this is Paul Bartosik, and then I will hand it over to Dan Rafalski, our Chief Actuary, to provide some more specifics. But similar to what you've heard from the other carriers, we are seeing care patterns return to what I would call pre-COVID-19 levels as recent as June of this year. I do again want to point out in my opening statement, I did mention that despite the uncertainty around COVID-19 impact in 2021, Harvard Pilgrim Healthcare is not loading our rates for any sort of COVID-19 claim experience. At this point, Dan Rafalski, could you offer any other specifics that may help the department understand the question?
Yeah. Thanks, Paul. This is Dan Rafalski, Chief Actuary at Harvard Pilgrim. Consistent with what you heard from other carriers, we have seen services return to, if you will, more normal levels across inpatient, outpatient, professional services. I do want to highlight a couple other things. I think it's important to note is that during this time period, we saw pharmacy costs, which represent 20 to 25% of the overall spend, really during this unprecedented time, go above normal levels and never really fall below sort of normal activity. So pharmacy costs have remained high during this unprecedented time. In addition, behavioral health services and access to behavioral health services, which have expanded through telehealth capabilities, they remained at higher than normal levels, not surprisingly given the challenges that we're all facing during this time. So similar to other carriers, we have seen things return to, if you will, the proverbial normal levels as early as late May, early June.
Thanks, Dan. So based upon the carrier's responses, all of your responses, I guess I could argue, and I guess the question is put back, and I'd like a brief response if you disagree. If we're looking at lower than expected utilization and mix/severity of services was lower for a handful of months and is returned to a level that you're more akin to and expecting in 2020, that if you look at 2020 overall, one could argue that utilization overall would remain flat for 2020, more in line with 2019 utilization, and mix of services. So the point is that there is a balance of what we saw as a decrease for 3 months and now returning back to normal levels. Is there any carrier out there that would disagree that 2020 for utilization at least, and possibly for mix of services, looks relatively flat compared to 2019? And I'll let anybody respond to that.
Hi, Paul. This is Toon Wing from Anthem. When you said flat, do you referring to also applying trend, taking from 2019 into 2020? Are you thinking about like just flat, there's no trend, compare second half to second half?
Yeah, if you look at the midpoint of 2019 to the midpoint of 2022, or 2019 calendar year to 2020 calendar year, the expectation would be that based upon the reduction in utilization for COVID in 3 months and the increase back to normal levels in other months, and this is assuming that there isn't a second wave and we revert back to lower utilization as the remainder of the year goes on, it sounds like there could be an argument that utilization would be flat for 2020 when compared to 2019. Do you understand the question too?
Yes, I do. So Paul, the elective surgeries that we're talking about, where provider and hospital cancel the elective surgeries that happen in March to May. Some of those elective surgery are coming back. So we see some of that happening in June, and we do anticipate that continue into the second half of 2020. So we do anticipate that some of those coming back. So we do believe that the utilization for second half is probably going to be slightly higher than the pattern that we saw in 2019. So that we already saw that happening in June, and we do anticipate that kind of pattern coming back in the second half.
Thank you, Tu. Would any other carriers like to respond?
Yeah, Paul, this is Neil from ConnectiCare, and I would
ahead.
agree that if I look just at utilization, I would expect 2020 to be a little bit higher than 2019 once all the dust settles. I'm also expecting a second wave starting sometime this fall. More people going in for flu shots, things like that, that will affect utilization as we go through the rest of the year. I would also point out that utilization, as you know, is only one component of trend. The other piece of this is unit cost, and unit cost, per our contracts, is higher in 2020 than it was in 2019, and that will continue as we enter 2021 as well.
Thank you, Neil. I think someone else wanted to make a comment.
Paul, this is Dan Rafalski from Harvard Pilgrim. Neil stole a little bit of my thunder, but I do appreciate him teeing up the other component around trend, obviously the cost trend, because we still continue to see provider or health system unit cost increases per our contracts. And also, when we think about mix of services, especially outpatient drugs that are used to treat certain cancer-related conditions, specialty drugs, and then the severity of claims, we continue to see tremendous trend pressures on that aspect of the business as well. So yes, utilization may have come down during this time period, but as Tu said, we do expect that to, over the second half of the year, to come back up and maybe even be higher than sort of 19 levels, but the cost trend pressure is also significant.
Okay, Dan, thank you. My last point on this, and I don't think we can belabor this enough, is if there is a second wave sometime, which many experts are expecting as we move into fall and early winter, if there is a second wave and COVID spikes, would the carriers agree that we would expect to go back to utilization levels for elective procedures and non-emergency emergency visits that we saw in March, April, and May? I would agree that there would be an increase in utilization of getting your flu shot, but I think the general utilization of elective procedures and non-emergent care would drop again to levels that we saw in March, April, and May. Would any carrier disagree if there were to be a second wave of COVID where we kind of return back to what we experienced earlier in the year?
Hi, Paul. This is Tu.
Yeah, go ahead, Tu.
So it depends on if we're going to do the shutdown or not. Paul, that's going to be the key. If there is a second wave, and let's say we decide Connecticut will not shut down, and then there might be some utilization reduction, but I would not say that it's going to go back to the level from March to May.
Thanks, Tu. Someone else wanted to make a comment?
Paul, this is Rob Koziar from ConnectiCare.
Go ahead, Rob.
I would argue that I wouldn't expect the shutdown to be quite as significant and as broad as what we saw the first time around. I think that the hospitals and the providers have learned a lot more from going through it the first time. I wouldn't expect that there would be quite the shortage of PPE that we experienced the first time around. I think the providers and hospitals now have protocols in place that they can continue to deliver these services fairly safely. And I think that patients and members, I think, would probably feel a little bit more comfortable the second time around in terms of continuing to get services than they did back in March, April, and May.
Thank you, Rob. Would any other carrier like to respond?
Hi, this is Mike from United Healthcare.
Yeah, go ahead, Mike.
I just wanted to say that I agree with Rob's points. I think he made a lot of very good points. And also to his point about the state ordered shutdown. I think if it gets to that level, we will see significant utilization drops. But I don't think they will get to the levels that we saw in March, April, and May. Just because, as Rob mentioned, there have been a lot of progress made by both healthcare systems, the providers, and just the preparation that we have at this point is much further than what we had at March, April, and May. I also think that there was an enormous fear factor in March, April, and May that really drove utilization down even further. I don't see that level of fear coming back at this time. So, thank you.
Thank you, Mike. Would anyone else like to comment?
This is Dan from Harvard Pilgrim. I won't repeat what everybody said, but I do agree that if there's a second wave, it won't be to the same magnitude that we saw before. As people have highlighted, providers are in a better position now to adapt to it.
Okay, thanks, Dan. Appreciate that. Another question the department has, and I think some of you touched on it in your opening statements, but I'd like to dig a little bit deeper into this. Many of you have made morbidity adjustments, whether they're in the individual market or the small group market. And I'd like to start with Anthem and ConnectiCare. I think both carriers have made a morbidity adjustment. I think Anthem's was about 1% and ConnectiCare was a little over 1% in the individual market. I thought I heard during the presentations that the carriers were describing it as if the fact that the people who need insurance, especially during COVID, are going to need it and hold on to it, and people who need it will sign up during open enrollment. I guess what I would argue is that I would expect less people to drop insurance who have insurance now, who may have otherwise dropped the insurance as a result of COVID, understanding that they may need the use of services. So I guess I'd like, in the order of Anthem and ConnectiCare, to respond to the fact that I don't believe there would be a deterioration in the morbidity of the insured population because of COVID, for an opposite reason. Less people will be dropping their insurance coverage that maybe otherwise would have if COVID didn't exist. I'd like each carrier to respond to that if I could. Anthem, go ahead.
Hi, Paul. We agree with you. The point that you made is people would less likely going to drop coverage. But on the flip side of that, people are uninsured today. More likely going, particularly those with conditions, are more likely going to join the individual segments. So that was the point that we made in the opening statement. But there are more than just those two scenarios. Right now, you probably know there's a lot of employers today are more likely going to drop coverage due to discontinuation of businesses. And it depends on how are those members when the employer drop coverage and how they would join the individual ACA. And that's going to be the key. If a lot of the healthier populations are dropping and go uninsured, and the high-risk population are the one would join the individual ACA, that assumption is very sensitive. The healthier, the dropping coverage and go uninsured, and the one with high-risk condition would join individual ACA, that's where going to be higher morbidity impact.
Thank you, too. Neil or Rob?
Yeah, and this is Neil. I would just add to the previous conversation that, you know, the other aspect of morbidity is people that for whatever period in 2020, you know, starting in March and ending, you know, maybe in June, July, not seeking care, right? You think of people with chronic conditions maybe not getting out to the pharmacy to get their drugs, maybe not going in for their routine blood pressure checks or routine, cholesterol screenings and things like that. There's a lot of literature available right now that indicates that the population, as we stay home and we avoid care, is getting sicker. And even if that was only a period of 2 or 3 months this spring, that's going to have a lasting impact and a long tail on it. The other piece of this that I consider is the stress and anxiety caused not just by COVID, but everything that's going on in the world. People feared for losing their jobs, home, people dealing with young children and having to homeschool. All of that's going on is going to have an adverse impact on people's health. So I think overall the population is going to get sicker, and as we go into 2021 and perhaps beyond, depending on how we start coming out of this and at what point.
Thank you, Neil. I'd like, I believe Aetna and Mary Beth, you had mentioned that Aetna also identified a morbidity adjustment. It's a fairly significant morbidity adjustment for small group. I'd like you to comment on what we've been discussing for the last 5 minutes or so. Thank you.
We have experienced deteriorating morbidity in our population year over year, as we are seeing lower risk groups term from our book of business and a higher risk profile for the remaining insured. One explanation could be that the healthier groups are more willing to disrupt their coverage, while the higher risk groups remain on our book for that continuity of care. But we are projecting that this dynamic will continue into 2020 based on our emerging data. And for simplicity, we assumed no change in the average risk score from 2020 to 2021.
Okay, thank you, Mary Beth. And I think a good follow-up question, and this is for all the carriers since you're all participating in the small group market, and I believe many of you, if not all, also participate in the stop loss market. To the extent that the expectation that the small group market it's certainly decreasing from a membership perspective, and there could be a number of reasons for that. Small employers that become large employers by employee count. The fact that small employers, I think somebody mentioned, are some of them are closing their doors and shutting their businesses down. But also another reason has been, and we believe it's been, is that employers, small employers, are looking at other options, including stop loss. I'd like to get a perspective from each of the carriers on stop loss and the impact that they believe that is having on the fully insured small group market. And I'd like to start with Mary Beth. I think we have seen the impact of that significantly in Aetna's fully insured business over the last 2 or 3 years. So if you could comment on the impact that stop loss in the small employer market is having in the fully insured market, at least from your perspective, and then I'll go down the line. Thank you.
Yeah, hi, this is Joe DeRazio. I'm the market head for small group for Aetna. I thought I could.
Okay, great. Sure, go ahead.
Commentary for this. Yeah. So we do not believe we've seen an impact on the fully insured block for small group. We've been in stop loss now since 2017 and have gone through these rate filings and looking at what we've seen from before these additional options were in market until over these last 3 years of rate filings, we aren't seeing an impact to the overall pool of small groups. So the way we're seeing it right now is it's increasing options and choice to small groups and small employers out there in the market.
Okay, great. Thanks. Anthem?
So, Paul, we did see some of that in the past. For 2020, we did not see, there are some movement, but not significant. So that's what we see from our perspective.
Okay, thanks to ConnectiCare.
Yeah, we saw some adverse impact in the small group market as people moved to the level funded products during 2019, which is when we evaluated this on a full year basis. Too early to tell right now. The experience so far in 2020 is quite limited, and there's a lot more moving parts this year because it's not just the impact of the level funded or the ASO solutions, but it's also the unemployment and employers stopping offering coverage and what have you. But no, we did see an impact in the most recent complete historical period.
Thanks, Neil. And Neil, can you comment on the average impact that you would say between the stop loss or level funded product employer, small employer versus what remained in your fully insured block?
I believe it was worth about 2 to 3% overall in a deterioration in the morbidity of the small group pool as people moved off into the level funded solutions.
Thanks, Neil. Harvard Pilgrim?
Yes, Paul, this is Paul Bartosik. So we do believe that there is some level of deterioration in the small group fully insured pool as a result of level funding or self-insurance for small groups. Harvard Pilgrim does have a product for choice. However, we have very little membership in that because we do believe in a very strong, robust, fully insured marketplace. And then I'll ask Dan Rafalski if he has any specifics from an actuarial perspective that he might be able to share and shed light further.
Thanks, Paul.
Yeah, thanks, Paul. The one thing I would add is, as we've seen the overall market and some membership move to the small group self-funded product, in our modeling and the modeling we do with external consultants, it has created more variability in the underlying risk adjustment projections, if you will. So that aspect of the small group self-funded market, in our view, has created some more uncertainty or variability as we try to project out risk adjustment numbers.
Great, thanks, Stan. And Mike from United?
Yep. So overall, based on our studies, the small group block has decreased by about 7% across all carriers. And we do believe that a lot of that is due to members and groups moving to a stop loss product. However, we have not seen similar results. Our membership has continued to rise, and our membership actually increased by over 10% in 2019. So we have not been impacted as much.
So Mike, when you say your membership has increased by about 10%, you're talking about your fully insured small employer market.
Exactly. Yes.
Okay.
Thank you.
My last question, and it's a follow-up to the commissioner's question from it was actually a navigator, consumer/navigator for the market in Connecticut. I just want to confirm that it is an ACA requirement that Anthem and ConnectiCare, being on the exchange in the individual market, are required at the outset of an inquiry from someone who is off the exchange to make available to them the products that you offer on your exchange, on the exchange at the same pricing level. So I just want to confirm from Anthem and ConnectiCare that if someone were to request it who is off the exchange, Anthem and ConnectiCare are giving these individuals quotes for on-exchange products at the on-exchange premium rates. I'll ask ConnectiCare first and then Anthem to respond.
Yes, this is Neil. So yes, the rate or the products that we offer through exchange are made available upon request to people off exchange, what I'll call direct. And the rates would be the same.
Thank you, Neil. And Anthem, please.
And Paul, the same thing with Anthem, Paul. If the members request, we will make it available to them.
Okay, thank you too. I have no further questions for the carriers. At this time, I'll turn it back over to Commissioner Mays. Thank you.
Thank you, Paul, and thanks to the companies for their presentations and for answering the questions that were placed before them. And I think it's really important. This is a very important part of the process, having companies come in to explain to their customers, the consumers, who also happen to be our bosses here at the department, because we work for the consumers of the state. But you have to explain the reasons that you were requesting these rate increases. We may not necessarily agree with you. I'm sure there are lots of consumers who don't, and there may be some who do. But we wanted to make sure consumers knew why you were asking what you were asking, that we had the answers to our questions. And this is why we wanted a public forum where we could speak openly and share any questions that we have. And as a reminder, if you're sitting out there and you have a question that you want to ask, you can email at cid.ratefilings@ct.gov. Now, at this time, we're going to turn to what I'd call the public portion of the meeting. This is where people who have previously registered to speak will be able to comment. And as I indicated earlier, we are going to limit each person to 3 minutes of comments or questions, and those comments or questions should be directed to the rate filings that we're addressing today. Jim Carson from the department will be our timekeeper, and I can tell you he will keep this moving. So, Jim, as we get ready, can you please bring up the first speaker in the order that they have signed up to speak? Jim will let you know when your 3 minutes is up, so you can please be prepared to conclude your remarks. Now, we have 3 people signed up to begin with. One is Lynn Ide, and Lynn is Director of Program and Policy with the Universal Healthcare Foundation of Connecticut. She will be speaking first today. Next will be the healthcare advocate for the state of Connecticut, Ted Doolittle, and he will go second. And third, we have the Reverend Joshua, my apologies, Reverend Joshua Pollack. And Reverend Pollack is a minister of the Unitarian Universalist Society East in Manchester. But we begin with Lynn Ide, Director of Program and Policy with the Universal Healthcare Foundation of Connecticut. Lynn, are you on the line?
Yes, I am.
Please begin, Lynn. Thank you for joining us.
Good morning, everybody. I appreciate the opportunity to testify this morning. The COVID-19 pandemic is challenging us all, and it is certainly impacting the finances and health of many state residents. I'll cut to the chase. This is not the time for any health insurance premium increases. People just can't afford it. A national report from Families USA showed that Connecticut's uninsured population had doubled in 2020. We do not need to pour salt on the wounds of those suffering with no insurance and/or no extra money to pay premiums, copays, and deductibles. Insurers are asking for increases in 2021, albeit smaller increases than usual. When CID issued its press release announcing the rate filing, Commissioner Mays was quoted saying, "The department will examine these filings with a fine-tooth comb to make sure these requested rates are consistent with state law. We will do everything we can to protect Connecticut healthcare consumers during the COVID-19 crisis." Bravo. I applaud that sentiment, Commissioner Mays. The tens of thousands of unseen people in this hearing, including the 256 people who signed our petition opposing the rate increases, want you to keep your word on this. Please do everything you can, Commissioner, to protect the people who count on these plans. Deny the proposed rate increases. I have attached the results of a statewide survey of Connecticut residents' views on healthcare. It was released yesterday by the foundation and conducted by the nonpartisan Healthcare Value Hub. You should read it. 69% of the respondents who purchased their own insurance said they fear they will not be able to afford it. Now, I know that you will say to me that statutorily, the department is not allowed to consider affordability to the consumer when reviewing these requests. In the past, the department has stated that there's no standard for consumer affordability. Well, it just so happens that the State Office of Health Strategy is working to develop a healthcare affordability index. It is not quite ready, but how about using the tool as a reference point in your rate review process this year? The insurers do not need more of our money in this pandemic. In fact, the pandemic has generally been good to the insurers' bottom line. Many are reporting higher profits for 2020. For instance, Anthem's income doubled to $2.3 million in the second quarter. In closing, the effect of year after year of premium increases is cumulative. They are unsustainable, especially in this time of household financial and health insecurity. I urge CID to use every tool in their toolbox to protect customers and turn down these requests to increase premiums in 2021. Commissioner Mays, please get out your fine-tooth comb. That concludes my spoken testimony. I just want to say that I submitted a little bit longer written testimony, and I want to note in order to try to keep under my 3 minutes, I did not include the section of my testimony talking about NAIC's work on racial inequity, and I want to commend the Commissioner Mays on your work with this group. I think it should not be ignored in this process. In fact, I cite in my written testimony a statement from NAIC's group on how you ought to be thinking about equity in rate review processes. And I also want to note the need for advocacy on the affordability index, because we really do need some way to measure how consumers are being impacted by these requests. And finally, I just want to say that I think it's very strange that you made the public wait until the end of the questioning to testify, especially when the technology that the state has imposed upon you is woefully inadequate for us to be able to see things and participate via video. And so if you're going to continue to do these hearings, I suggest that you figure out a way to be a little bit more consumer friendly and let us speak at the beginning of the hearings. Thank you very much.
Thank you, Lynn. I appreciate your comments. Just as a purely technical issue, these hearings were done online clearly so that as many people as possible would be able to be a part of them. The structure is an existing structure. We've always had the insurers present make their presentations first so they can share with the audience, usually a large portion of that, or there are significant numbers of people that are actually in the room that can react to that. I apologize if this is not as consumer friendly as you would like. We have worked on it, and we will get better as this goes on. We are trying. That much I can tell you, because we do want to hear consumers. We want as much consumer involvement as possible. So thank you, Lynn. And by the way, for those who are listening, joining in, who would like to get Lynn's comments, the department will have those posted, her full testimony along with the other testimony, so you can get those and read all the information, not simply the summaries that are presented here today. And now we'll move on to the Office of Healthcare Advocate, Ted Doolittle. Ted, are you there?
Hi, Commissioner. I'm here. Can you hear me?
Yes, I can. Ted, please go ahead.
Okay, thanks so much. So as Commissioner Mays indicated, my name is Ted Doolittle, and I'm the head of the State Office of the Healthcare Advocate. And for those of you who aren't familiar with the Office of the Healthcare Advocate, or as we call it, OHA, let me just quickly tell you that we have a staff of nurses, attorneys, paralegals, and others that are standing by to help folks who are wrestling with their health coverage in one way, shape, or form or another, whether it's a billing dispute with their insurance company or it's a denied claim or something like that. Our case managers provide free expert help to anybody in Connecticut or whose employer plan is based in Connecticut. So reach out to us. I want to first thank the commissioner and the staff, as well as the very thoughtful presentations by all of the carriers. I salute your professionalism, and I appreciate the work you're doing to try to provide coverage to Connecticut's citizens and others. I want to set the context a little bit for what we're doing here, which is a very, very important thing. I regard that our community, our national community, has four main challenges that we're looking at. There's climate change, there's systemic racism, there's income inequality, and there's healthcare affordability. It's really in the big four of what we need to deal with. And Martin Luther King stated that of all the injustices, the inequality in healthcare was the most egregious of all, and we need to be mindful of that. All four of these items, all four of these challenges are marked by research and undisputed numbers. Climate change, there's just no getting around the fact that it's getting hotter. Racism, just take for instance the number of CEOs of Fortune 500 companies. It should be by population around 50. It's actually at 4. Income inequality, we're back to Gilded Age levels of inequality. It's causing huge stresses on our society. We've got a situation where the 3 richest people in America hold more wealth than the bottom 50. That's just unbelievable. In healthcare, why is the United States spending 18% of our GDP, whereas our economic competitors spent 11% of their GDP? The research is very clear. The healthcare in America is not better. We don't get more healthcare. There's not more waste in America. It comes down to prices. The prices are higher in our community, and egregiously so. And as Warren Buffett has stated, this is an anchor on our economic competitiveness. It's the albatross of American economic competitiveness, I believe Warren Buffett said. Where are the prices highest in our system? It's in the commercial insurance. It's in the job-based insurance, and it's also in the individual and small group market where people buy their own insurance. The self-funded plans, a little bit of talk about them in the stop loss earlier, and that's good, but they're really beyond the state jurisdiction. So what we're talking about here, of course, is the fully insured market. But I just want to set that little bit of context. We're at an important point here. This meeting is just a skirmish in a much larger community struggle to deal with one of the 4 defining crises of our time. And I have complete faith in the men and women of CID to dig into these cost reports and do what they need to do. I salute Commissioner Mays, Paul Lombardo, other senior leaders and staff level folks who are going to be working on this. Also, thanks so much to ConnectiCare, Anthem, all the carriers for everything they've done. All you folks that I've just referred to have a lot of influence on where to look and where to take this type of review, and where we need to go, as I suggested, is prices, and the bar is higher this year. I just want to point out that fellow states have lower increases in many cases. The most recent ones, just referring to the individual market, but we could do the same on the small group side. Florida, 1.8% in the individual market increase. New Hampshire, individual market down by 11%. There's some special circumstances there. Maine down in the individual market by 13%. Virginia down in the individual market by 7.2%. Delaware down by 0.5%. Those are just the most recent ones that have come out. So we have a bar to meet here, folks. And again, prices is where to look. We need to really turn a revolution here and start to grapple with a longstanding problem. Contract price transparency is needed. The old days of not being able to share the prices based on proprietary or whatever the concerns are, especially in the days of the high deductible health plan where you're asking the consumers to shoulder out of pocket more and more, those days are gone. And we have to ask, look, trend isn't something that happens to us, right? It is driven by the providers. And to the extent that the insurers are saying the trend is what it is, we have to remember there's a dynamic between the providers and the insurers that since 1980 has resulted in dramatically higher prices and costs in this country than in other countries. I think the insurers, and I'm speaking really to the rising generation, the folks who are in their 20s, 30s, and 40s, who are not at the very apex of their careers yet. The commercial sector, commercial insurance sector, self-funded as well, is where the costs are highest. I don't need to remind anybody on this call that the public plans like Medicare and Medicaid, they've been able to establish more internationally competitive prices. It can be done in the United States. I know that the mantra of is always the cost shift. We have to charge more to the insurers because we're charging the public plans. But folks, the public plans are priced at an internationally competitive rate, and I don't think the hospitals in Germany or Canada are going out of business. That's kind of the larger message that I'd leave folks with, and leave both the folks at the carriers as well as on Commissioner Mays' staff, that we really need to get underneath the dynamic. And my suggestion, as it has been in the past, won't be any surprise, is that this is an opportunity for our community to interrogate where these prices are coming from. And it's coming from industries, healthcare industries, and it's coming from specific providers. So this moment in coming years, this rate hearing moment, should build on the cost growth benchmark and other initiatives that the governor has set up to start to delve into what proportion of the rate increase is coming and going to which providers, and this should be an accountability moment for providers as well as carriers. I probably have gone over my 3 minutes. I appreciate the time. We did file some additional questions that will appear in the record, and I do once again want to thank Commissioner Mays and his staff for what I know will be the fine-tooth comb review that he promised. Thanks so much, Commissioner Mays. You may be on mute, sir.
Sorry about that. Thank you, Ted. You're very helpful here today. I really appreciate it. For those who may not know, Ted referred to the benchmarking study. That's a study that Massachusetts has used for the past, I think, 7 years. They've looked at prices. They've looked at where spending happens within the healthcare system, how spending could properly be shifted. And my friend Vicki Veltri, who's the executive director of the Office of Healthcare Strategies, under the direction of Governor Lamont and the Lieutenant Governor Susan Bysiewicz, is working to develop such a benchmark system for Connecticut. So Ted, just, I know Ted already knows this, but for the people who are listening who may not necessarily have been aware, we are moving forward with this. Now I'm going to turn to our third listed speaker, and that is the Reverend Joseph, and for some reason I keep saying Joseph, it's Joshua, Reverend Josh Pollack, who is the minister of the Unitarian Universalist Society East in Manchester. And Reverend Josh, are you on the line?
Yeah, I just want to make sure I'm audible.
Yes, you are. Please go ahead with your testimony.
Great. Well, thank you for this opportunity. I really appreciate it, and I really appreciate the support from your staff, Commissioner Mays. In my written comments, I've highlighted some high-level reasons why rate increases at this moment would create even greater hardship for individual small business and nonprofits already struggling due to the economic downturn created by the pandemic. For all those reasons I highlight, I respectfully ask that the CID reject rate increases at this time. I want to give you a little background so you know where I'm coming from. Like many small businesses and nonprofits, the church I lead in Manchester takes great pride in providing health insurance to all its employees. In the best of times, we struggle to find quality, affordable plans. Every spring, we meet with the broker. Every spring, there's bad news, greater expense, less coverage, higher deductibles. Every 1 or 2 years, we drop the plan we had because we can no longer afford it or because it doesn't meet our needs. We scrounge around We scrounge around the less comprehensive higher deductible plans in search of something that might fit within our budget constraints. Last year we went with Anthem. This year we've selected an Oxford plan. Changing every year is lousy for our staff. And that's how it works in the best of times, which I think is shameful commentary on our system. But this is not the best of times. This year, like so many small businesses and nonprofits, we took a financial hit when we could no longer run in-person fundraisers, and we had a significant number of our member donors who couldn't increase their annual giving due to job and financial market uncertainty. We did receive a generous loan through the Federal Paycheck Protection Program, but we still have no room in our budget to absorb rate increases for health insurance. It's really hard right now. I hear insurance companies on this call predicting Connecticut residents will become sicker due to all the stresses on our lives. Rate increases may be a prudent financial response to that prediction, but they will absolutely become one more source of excruciating stress in our lives and likely force more people into the ranks of the uninsured. When rates go up, some people, some businesses will drop coverage. I've heard that reported on this call as well. Please understand and take seriously the real financial challenges small businesses and nonprofits are facing right now. Please add corporate and governmental compassion to the calculation for rate determinations. Please, no rate increases in the middle of a global pandemic. Thank you.
Thank you very much, Reverend Pollack. And I think that brings us to the end of our listed speakers, but we do want to make sure everybody has an opportunity to speak. Jim Carson, is there anyone else from the public who would like to provide comments?
There's no one else at this time.
Are there any chat comments, Jim?
No, there aren't.
And how about any emails that were sent to the email address?
There are no emails at the time.
Thank you. Thank you, Jim. Well, then, this concludes this informational meeting. Let me thank everyone for taking time out of your busy schedules to attend today's meeting. We truly appreciate everyone's comments, and the department will work to, we will take into account what you've said, and we will work to make sure that we do the best for the citizens, for the consumers here in our state. Thank you for joining us. Good morning.